The National Health Insurance (NHI) is designed to allow every Grenadian to benefit from all medical services that are being offered. As opposed to the private health insurance, the NHI has no restrictions and provides an avenue for fast and readily available medical services. Speaking at Tuesday's post-cabinet briefing, Minister for Implementation Emmeline Pear says the University of the West Indies Economic Department has committed to provide technical support to the National Health Insurance.
In addition to that, we have also been seeking technical support, and only about a week ago we had a team from the University of the West Indies headed by Professor Theodore, who most of us would be acquainted with, and his passion and involvement on the road to NHI going many years ago, and even in recent times, work that he has done. We have gotten a commitment from UWI through that department, the economics department, that they are going to be providing significant support to us. As a matter of fact, they intend to provide us with a report that would also speak to direct support that they would be able to provide.
Minister Pear also explained that the major objective of the NHI is to provide care for everyone regardless of their circumstances.
So the National Health Insurance is available and will be available to every Grenadian citizen. Of course, I believe it's very important to establish that it will not be limited to sex, it would not be limited to age, and I particularly want to emphasize age, because many of us are aware that if we sign up for private health insurance, in many cases there are limitations with regards to age. There will be no restriction as it relates to your medical condition. Now, if any one of us try to sign up for a private health insurance right now, one of the very basic things that would be required is a medical examination. So we go to Dr. Martin or we go to a doctor and we say, we are applying for medical health insurance, we need to do a full examination, medical examination. And the sad thing about this is that if you're found to have any condition that the insurance company will be concerned about, they would refuse you membership in that health insurance. The opposite would happen in national health insurance, regardless. So if you're a cancer patient, you don't have to come and fill up the form and probably hide to say that you're a cancer patient, because there'll be no restrictions as it relates to your medical. This is about caring for everybody, regardless of their circumstances. That is what NHI wants to bring to our people.
The initial time frame given for the commencement of NHI was by June, and the minister said the public can expect some important announcements regarding the program by the ending of the month.
I am hoping that by the end of July, when those important announcements are made, you would be able to hear dates as it relates to the commencement of registration. You would be able to hear dates as it relates to the process of implementation. And I'm hoping that by that time you would also be able to hear figures as it relates to what people might be expected to contribute to NHI.
Several meetings were held with various stakeholders and public consultations are ongoing. The next consultation will be held on April 19th in Bonaire St. Mark's, and a special consultation will be held for media and religious personnel on a date to be announced. Akisha Felix for GBN News.